light therapy, and phototherapy. In this lecture, we will also discuss lasers, also known as light amplification by stimulated emission of radiation. Low-level laser therapy and light therapy are sometimes also known as light therapy or cold laser therapy. Other terms and acronyms used to describe light therapy include phototherapy, cold lasers, soft lasers, low-energy laser, low-level laser therapy, low-intensity laser-activated biostimulation, low-power laser irradiation, low-power laser therapy, low-intensity lasers, and monochromatic infrared energy. Leaders in the field are calling for clinicians to use the terms light therapy or phototherapy as they more correctly identify the treatment being prescribed to our patients. Light therapy is a broad term that refers to the application of light for a variety of devices for many different therapeutic purposes. Devices including lasers, light-emitting diodes, also known as LEDs, superluminous diodes, also known as SLDs, fluorescent lamps, infrared lamps, ultraviolet lamps, also known as UV lamps, diachronic lamps, and very bright incandescent light bulbs can also be used for therapeutic purposes. Light therapy began with lasers in the 1970s. Laser is an acronym for light amplification by stimulated emission of radiation. We'll discuss further. Light therapy can be used to treat orthopedic injuries, skin conditions, and psychological problems, such as depression and seasonal affective disorder, and also to tan the skin. For the purposes of learning, we will focus on the use of therapeutic lasers and LEDs, and we'll touch on UV radiation. The therapeutic theory is that specific wavelengths of laser light, when absorbed, cause specific physiological responses within the body. Although the therapeutic value of these responses has been debated within the literature, and therefore this is a hotly contested therapeutic intervention protocol. Although there is mixed review regarding the merits of light therapy and photobiomodulation, many clinics still advertise their therapeutic value. This is an example from a physical therapy clinic, indicating lasers' mechanisms of action. Both lasers and non-laser devices deliver light of specific wavelengths, although the way the light is generated and some of its characteristics are different. There is no consensus about the relative merits of these two technologies. To produce laser radiation, a laser device must have an energy source, a mechanical structure, and a lacing medium, which can be a gas, liquid, crystal, chemical, or semiconductor such as LEDs. Differences in lacing mediums will result in differing wavelengths, levels of light coherence, and levels of light divergence. Laser light is very different than normal light. Laser light is monophasic, monochromatic, coherent, and non-divergent or directional, meaning it is composed of particles or light with equal energy and of a single phase and color that move in step with each other. The following are terms, definitions, and characteristics of lasers. Light. There is an electromagnetic radiation that can produce a visual sensation. Amplify. To increase in size, volume, or significance. Stimulate. To excite or invigorate. To encourage or provoke something to grow, develop, or become more active. Emission. A flowing forth, such as the release of electrons from parent atoms. Radiation is the transfer of energy in the form of rays, waves, or particles, often from a central source, also called radiant energy. The characteristics of light. Light beams can be divergent or non-divergent. Light beams can also be monochromatic, fixed-phased, coherent or incoherent. On the left, we have divergence of light, which is illustrated by contrasting A, a non-divergent beam, with B, a divergent beam. On the right, there are wave patterns of 3 different types of light. The top, A, is the light from a common light bulb. It is composed of waves of different frequencies and phases. The middle, B, is an LED light. An LED emits light with waves of the same frequency, also known as monochromatic, but out of phase, which is incoherent. The bottom, C, is a laser light. The laser emits light with waves of the same frequency, meaning that it is monochromatic and in phase, also known as coherent. Some other terms that might help you understand laser. Electromagnetic energy. One of the fundamental forms of energy in the universe is electromagnetic energy. Its characteristics change radically depending upon the frequency and wavelength, which tend to correlate closely with each other. Frequency is the rate of vibration of a force or a wave, usually measured relative to local time. Visible light, an electromagnetic wave that is divergent, multichromatic, incoherent, and multiphasic, is visible to the naked eye. Something that is non-divergent is incapable of separating or widening. This contrasts with the light from a laser pointer, non-divergent, with that coming from a flashlight, divergent. Non-divergent light is also known as directional light. Monochromatic, having a single frequency or a single color if it is in the light spectrum. Coherent, logically ordered or integrated. This is a quality of the electromagnetic waves that have the same wavelength and a fixed phase relationship. Fixed phase, the unified launching of the wavefronts of all light particles of a laser beam. The effects of laser are largely determined by the amount of energy it emits. High-energy lasers produce a great amount of heat, which is useful in welding or shooting down satellites. In the human body, though, tissues are destroyed if high levels of energy are applied. While this may be desirable to a surgeon, it is typically not the goal of an athletic trainer or other rehabilitation specialist. Therapeutic modality lasers emit low levels of energy, usually less than 500 milliwatts, that do not heat body tissues. These are called low-level lasers, or can also be referred to as cold lasers or soft lasers since they do not heat body tissue. Lasers are possible because of the dual nature of light. It is both a wave and a particle. When light travels from one point to another, light acts as a wave of oscillating electrical and magnetic fields. When it is absorbed or emitted by atoms, it acts as a particle. The particles or packets of energy are called photons. The amount of energy of a given photon is a function of its wavelength or frequency, since each photon has a unique wavelength and a unique function. Laser energy production requires 4 components. An amplifying chamber or resonating cavity in which the stimulation and amplification take place. A lacing medium, which may be a gas, liquid, crystal, chemical, or even a semiconductor that is placed in the amplifying chamber. We need an external source of energy, either electrical, chemical, or optical, and a pair of mirrors at either end of the amplifying chamber, only one of which is half silvered, meaning it reflects. A light-emitting diode, also known as an LED, is a special type of semiconductor diode that emits visible light when an electrical current is passed through it. A superluminous diode, or an SLD, is brighter than an LED. As electricity passes through, the diode gives off energy in the form of protons. The wavelength of the energy given off, and thus the color that is emitted from light, is determined by the chemical composition of the doping materials. LEDs and SLDs are typically covered by plastic cases of varying colors. The plastic case has no bearing on the color of the light. It simply is used to indicate the specific wavelength of the energy emitted by the diode, and therefore the color of the light. Light emitted from an LED or an SLD is monochromatic, but not coherent. This means that the light will be more scattered than that of a laser, and therefore less of the light will strike the target. Thus, less energy is imparted to the tissue. Other things we should know about light-emitting diodes. LEDs are a special semiconductor diode that emits light from ultraviolet to infrared spectrums and lack coherence. LEDs can be printed onto flexible substrates, creating flexible light patches that can be adhered directly to the skin. We also have something called organic light-emitting diodes, or OLEDs. These convert blue wavelengths into green, yellow, red, and even infrared. Types of light sources. Since both semiconductor-based lasers and diode devices use LEDs and SLDs, one might think that the light delivered from the two devices is the same, but that is simply not true. Both lasers and non-coherent light sources are used in photobiomodulation. Photobiomodulation is the act of modifying biological processes with light. This stimulates the tissue in a way that modifies pain and/or the healing process. The older term for this process is biostimulation, but this term is not really correct. Sometimes lasers don't actually promote the healing process. Rather, they inhibit biological processes, such as reducing pain. The safety classification of lasers. Safety is determined by the amount of energy applied to the lacing medium and the subsequent amount of energy released in the form of light. In other words, the power of the laser. The greater the power of the laser, the greater the potential danger. We can see in this chart different classes of laser, a class 1 through a class 4. We can also see as we move from class 1 to class 4 lasers, they become more and more dangerous, so we do have to be careful with using different lasers. Photobiomodulation treatment parameters. Light therapy can be described with its wavelength, which is measured in nanometers. It can also be described with a duty cycle and its frequency. The duty cycle is the percent of time that the laser or light source is active. This is represented as a percentage of time. Something that has 100% duty cycle is active all the time. We also have the frequency, which is measured in hertz. The beam size is measured in centimeters. Power and irradiance are measured in watts per centimeter squared. Treatment time is measured in seconds. Fluence is measured in joules per centimeter squared. The total energy is calculated as joules. We have our application technique and even a treatment schedule, which we'll discuss in further detail. The wavelength. The wavelength determines the color of the light. Often, photobiomodulation devices are referred to by their color of light. Lasers are often referred to by their color, such as a red laser or a violet laser. This practice is imprecise, though, and many clinicians and researchers recommend against it. For example, all lasers with a wavelength of 150 to 380 nanometers are ultraviolet, but the tissue responds to a 150 nanometer laser differently than to a 380 nanometer laser. So each laser should be referred to by its specific wavelength rather than calling them both ultraviolet lasers. The duty cycle is like ultrasound or diathermy. Duty cycle equals the on time and the off time of the light. This is calculated with a formula. The time on divided by the time on plus the time off, all divided by 100, and this equals our duty cycle. If the light is pulsed, the light's frequency should be reported. Current clinical trials suggest that pulsed light may be superior to continuous photobiomodulation. Beam size is the radius of the light aperture. This is the size of the beam, which affects the photobiomodulation irradiance. Irradiance is the device power in watts divided by the beam size, which is centimeters squared. Irradiance is the measure of power that a light is emitting over an area. Basically, this will be the amount of energy a portion of your body is receiving at a given time when using the light therapy. In light therapy, the most common format to measure irradiance is watts per centimeter squared. Treatment time is typically reported in seconds. This may be reported in seconds per spot or total treatment time during a scanning mode. We'll discuss what a scanning mode is in just a minute. This should be determined for each device based upon the device's irradiance and the desired fluence for the treatment protocol. The dosage or fluence depends upon three factors: the average output power, time of the light exposure, and the treatment area. The dosage is given in joules per centimeter squared. The average power is the average output power of the machine listed in watts. Treatment time is the length of treatment in minutes or in seconds. And the treatment area is the area of the laser beam or area to be treated in centimeters squared. The power output of a laser is fixed, and the only way to alter the dosage is to alter the time of application. Treatment time must be computed for each specific device because the output differs among devices. Treatment time is computed from the total output of a specific device. Dosage ranges for specific conditions have been derived from available research and mathematical theory. In this table, we can see some common conditions and their dosage and any notes available. For example, if we were to treat superficial wounds, the recommended dosage is anywhere from 0.5 to 4 joules per centimeter squared. The recommendation is to increase dosage as the wound bed develops over time. Here is another example of basic recommendations for laser treatment dosages. For example, we have some common conditions such as muscle strains, tendonitis, ligament sprain, stress fracture, open wounds, and myofascial trigger points. We can see if they are acute or chronic, there are different protocols. For example, for tendonitis, we may have 3 to 6 treatment points with a total dosage of 24 to 30 joules. If it's chronic, we may have 5 to 8 treatment points with a treatment total of 35 to 45 joules. Therefore, coming up with specific protocols for specific treatment areas can be difficult depending on what research you are looking at. The total energy in joules. The total energy is delivered to the tissue. This is a calculation of the total energy in joules, which is calculated from the average power or watts times the treatment time in seconds. Or could be the total energy in joules is equal to the fluency, joules per centimeter squared, times the beam size in centimeters squared. Currently, there is no consistency in reporting fluency or the total energy. The World Association of Laser Therapy has created a specific guideline based upon 780 to 860 nanometers and 904 nanometer wavelengths. The application technique for light therapy. Light therapy can treat a variety of different sites, including lesions, wounds, and areas of pain, nerve roots, and trunks. trigger points or acupressure points, and lymphatic and blood vessels. Most lasers use a single laser probe to deliver light of a specific wavelength to tissues. However, in recent years, cluster probes have been used to apply multiple wavelengths to a larger area during treatment. For optimum delivery of laser light, the laser probe should be in contact with the skin to minimize divergence and reflection. In the case of open wounds, the probe may be held close, less than 1 centimeter, to the wound without touching it. Some clinicians even place a sterile, transparent film over the open wound so that the probe can be placed in contact with the damaged tissue. The cluster head is the best option for treating large areas. When a cluster head is not available, a single probe can be used in one of two ways. Sequential application to multiple areas of tissue, called a grid application, or moving the head across the area like an ultrasound head, a technique called scanning. To use the grid application, imagine the treatment area as a series of 1 centimeter squared segments. Systematically treat each segment with the appropriate dosage for the condition. Scanning consists of moving the laser probe back and forth of the treatment area at a slow and steady rate. Each pass progresses across the wound until the treatment area has been covered. Then treat the entire area a second time at 90 degrees to the first pass. The dosage is much less accurate using a scanning method. For treatment over trigger points or acupressure points, slowly move the laser probe and apply more pressure for a massaging effect. Ask the patient to tell you if the pressure is too great. For optimal delivery, application or the patch should be in contact with the skin to minimize divergence. For open wounds, the applicator is held close but not touching the open wound. Here are some examples of different configurations of photobiomodulation therapy. Figure A is a light fiber or single multi-laser LED probe. Figure B is a multi-head solid-state laser, an LED cluster. Figure C is a light panel, pad, or a light bed. And Figure D is an example of printed light. This table explores the advantages and disadvantages of photobiomodulation configurations, such as an LED probe, LED clusters, light panels, pads, and beds, and the printed light. The depth of penetration is a major issue with light therapy. No matter how effective the light is on a specific tissue, its effect is of no value if it does not reach the target tissue with the appropriate dosage. As light is absorbed by various tissue cells, the depth of penetration is reduced. Laser penetration is a function of its wavelength and power. Although wavelength is probably the most important factor in determining the depth of penetration, there must also be a driving force. The driving force is the power or the amount of energy that is being applied. The near to mid-infrared spectrum, 1,000 to 1350 nanometers, appears to penetrate the deepest, 3 to 5 millimeters. It appears from the literature that light therapy may be beneficial for treating wounds and pain originating from superficial tissues. Since light energy is absorbed by superficial tissues, its use is limited for deeper injuries. Melanin, a pigment that contributes to skin color, absorbs light in the visible spectrum very well. Therefore, patients with darker skin may absorb more light in the cutaneous layers, preventing the light from penetrating into deeper tissues. In addition, the production of melanin is triggered by light in the near ultraviolet range. This could result in darkening of the skin or scar tissues as more melanocytes are produced. We also need to consider obesity. Considering the issues related to the depth of penetration of therapeutic light, The thickness of the subcutaneous fat should be considered when treating conditions that exist deep to the subcutaneous layers. It seems debatable whether light therapy can reach deeper tissues at a dosage appropriate for treatment. When the subcutaneous fat layer is excessively thick, the likelihood of therapeutic dosages reaching deeper tissues is even more questionable. The effects of photobiomodulation. When light is absorbed by tissues, it acts at the molecular level by one or a combination of the following mechanisms. It increases the mitochondrial ATP production. It produces cellular protective effects and anti-inflammatory effects. It increases collagen synthesis by fibroblasts. There are analgesic effects. Nitric oxide gets released. There's an increase in vascular perfusion, and light therapy is a bacterial side, meaning it kills bacteria. Additional effects of photobiomodulation. Photobiomodulation can be utilized to help treat pain. The total energy doses over the course of multiple treatments of 120 to 162 joules and 15.36 and 20.16 joules are effective for acute musculoskeletal trauma, myofascial pain, rheumatoid arthritis, carpal tunnel syndrome, low back pain, trigger points, and even treating neck pain. Other effects of photobiomodulation. Photobiomodulation can be utilized to help treat musculoskeletal injuries and to promote wound healing. During the inflammatory phase, we see an increase in mast cells that release histamine and heparin. There's an attraction of immune cells. Improved microvascular perfusion, which results in increased local blood flow for the clearance of cellular debris, edema reduction, and eventually antibacterial effects. During the proliferation phase, we have an enhanced collagen formation in the granular tissue and enhanced endothelial or blood vessel development. Lastly, the remodeling phase, we see wound contraction and increases in tensile strength and stress. Photobiomodulation can be utilized for muscle performance, fatigue, and recovery. Research previously has been conducted with Rindstar rats, professional volleyball players, and laboratory participants, which all supported photobiomodulation to increase muscle performance. Red and infrared wavelengths were demonstrated to improve muscle recovery. Infrared and red photobiomodulation therapy before strength training resulted in improved strength gains for research participants as well. This is a new area, so we'll have to look for more research coming out in these effects. So how do we use our machines? We pick a tissue that we want to use the laser for. This could be something like bruises, scar tissues, or maybe even an ankle sprain. We're going to turn on the machine and set it up for laser. We will turn on the machine and click Light Therapy. Here's the button here on the left. Then pick the amount of time or energy you want to use. They're interchangeable. Clean the skin with a cleansing cloth. Do not use a laser on wet skin. Let the skin dry before we use the laser, due to the potential risk of damaging the laser with wet skin. It is okay to use a laser on an open wound, but you must try to cover the skin with clear plastic to ensure no contamination occurs. Select the joules, which will change the amount of treatment time, and then press Start. This activates the laser head. You can then apply the laser head to the skin and press Start. Do not remove the head from the skin unless you're doing a scanning movement. The treatment will not be as effective in the scan. There is a potential for damaging an individual's eyes, so we need to make sure that we're wearing protective eyewear during laser use. Even with the low power output of therapeutic lasers, the light is sufficient to cause damage to the eyes. You and your patients must all wear protective goggles during laser application to prevent incidental exposure of the eyes to the light. Goggles are equipped with light filters aimed at reducing the incident light. If the area is large enough, multiple applications are a good idea for our treatment parameters. Apply the laser head to the skin and press the power button. The light will turn from yellow to green when the laser is on. The laser light will then turn red, which means the laser is active. Leave the laser on the skin until the time is up. Then either apply it to another area's skin or turn off the machine. Be careful with the laser. Don't just throw it down, place it in the correct holster, and only clean it once the laser is completely cool. Otherwise, we risk cracking the head of the laser.